Okay, guys, here's part two. I so after surgery, I was in a lot of pain. Uh, Day two, they took me to do my swallow test to make sure that I didn't have um, any leaks or anything in my pouch. Um, Let me tell you. So they took me into the little scanning room or whatever, the radiology room, and I hadn't been up and walking or anything by this point at all. And my nurse told the people in the room she has had a lot of pain. She has not been up yet. So they had to move me from my bed to the table, and they slid me on this like little slippery board thing. And they called in two other nurses to help. Well, the two other nurses that help, of course, they do most of your surgery, and I don't know if everybody is this way, but the incisions on the right side, on your right side of the body, those are the ones that are worse, and those are the ones that hurt. They say about 6 to 8 weeks are still sore. So it was my right side, of course, that was the worst. Well, I'm laying on the table, and they bring two other like little helper girls in to help get me over onto the table. Well, when my nurse said, grab the blankets and lift and push, not to push on me, but lift and push with the blankets. Well, the one girl that was standing up to on my right side decided to put her hands on my stomach and push as if she was moving a piece of furniture. And I start screaming and I hit her hand away, and I'm like, don't push there. And I screamed at her and I was like, do not push there. So she pushed really, really bad on my incisions on the right side of my body. So that was the first bad experience. Then the third day, they moved me up to my room. Um, they put me on the hospital here on the 8th floor, where it's any type of stomach surgeries or anything like that, and the cancer floor. And most of the people on that cancer floor are terminal. So they moved me up there, and I'm in that room. Well, there was a student from one of our colleges here, um, a student nurse helping out. The nurse that I had initially was a guy, and he came into the room when they first moved me up there. Didn't see him again at all. It was the student nurse girl that kept coming in there. Well, when they first got me in the room, the guy left. The student nurse girl just starts, you know, granted I'm naked, all I have on is my gown. The student nurse girl just starts lifting up everything, not telling me what she's doing at all, just lifting up my gown and this and that, and let me look here. And then she asks me, well, can you roll over on your side so I can look at your back? I'm like, are you kidding me? I've been in the hospital for 3 days already, and you want to look at my back? And I'm like, please take their word for it from downstairs. You don't need to look at my back. And I cannot roll up on my side. I have incisions. And she just kind of looked at me like, well, well, please, like, I really need you to move up on your side. No, the fuck you don't. Sorry. And what are you doing just looking at my gown and not even, I understand she has to do her initial evaluation, and that's fine with me, but tell me what you're doing before you just lift up my gown and expose me. And, there wasn't anybody else in the room, but still, I don't know you from Adam and Eve. I'm not a shy person, but at the same time, just let me know what you're doing. Um, I was actually, it had been 3 days since they changed my gown, changed my bedding. My cousin is a nurse, so she was up there with me, and she helped me take a sponge bath, change my bedding, change my gown, let me brush my teeth. They didn't do anything that they were supposed to. The nurses were like MIA. I had problems with anesthesia, and not with anesthesia actually. It was actually the pain medicine. They gave me Dilaudid, which is even worse than morphine, and I started having respiratory problems. I kept not breathing. Like anytime I was asleep, I would stop breathing, and it's not sleep apnea. It was due to the Dilaudid. It started sending me into respiratory distress because my vitals started dropping and my blood pressure was extremely low. I had blood pressure at one point which was like 86 over like 65, and so they kept me on the Dilaudid, but they just kind of lowered the dose, so I kind of had to deal with the pain a little bit more. Um, and so that was part of the other reason why they kept me in the hospital, because I wasn't doing very well with that. Loratab, which I'm taking now, the liquid Loratab, I do just fine with it. That doesn't bother me, and I've taken it in the past, so it's never bothered me. They give me a huge bottle, and I'm actually on the second bottle, which I didn't think I would need a second bottle, but I definitely did. It has been a long road. Um, Still trying to recover. Initially, I thought to myself, if I knew the pain and how hard it was going to be. I mean, I know that after any abdominal surgery or any type of major surgery, that it's going to be difficult getting around. But I, I was told myself in the beginning, if I knew that it was going to be like this, I probably wouldn't have done it. But to be honest, I still would have, because this surgery, of course, for me is helping me get my life back and move on with my life, because I'm still young. I still have yet to start my life. So that's really my hospital experience. It was not great. Um, I had many nurses that I didn't get to know, and it was just kind of all over the place. I was pretty much by myself most of the time. The only time there was a nurse that came into my room was if it was time for my pain meds, and it just was not the greatest. So I hope for any pre-uppers out there that you end up with a better story than mine. And Lady Bubba, I'm so happy you got your surgery date. Congratulations. I can't wait to video chat with you. I'm so excited, so we do have to set that up. I'm actually getting in some pain right now, so I'm going to go. Thank you all for watching, and I will update. I go for my 2-week pre-op on Wednesday, which is a day after my 2-week pre-op. So I will be weighed on that day, and I'm also going to try to post some pictures. I'm going to figure out how to do that. So I will update after my 2-week post-op. So congratulations to everyone out there with massive amounts of weight loss and happiness, and good luck to those of you who are going through your pre-op steps. I know it's definitely a long road and it's hard, but stick with it, and hopefully it's worth it in the end. Bye.